Hello guys, I hope that you are well. Today we will continue with the technology class. Today we will see the personal hygiene. Body grooming, teeth and hands cleaning. The most suitable means for cleaning the body is daily bath with soap and water. So we will start with the hygiene of the mouth. We must keep it clean, brushing the teeth after each meal using paste and brush. I'm going to show you the correct way that you have to brush your teeth. This is the correct way that you have to brush your teeth. So first of all, we are going to place the toothbrush at the 45-degree angle to the gums. As you can see here in this picture, I show you how do you have to start brushing your teeth. So the second one, gently move the brush up and down each short stroke like this. Look, this is the movement that you have to do when you are brushing your teeth, up and down. So number 3, brush the outer surfaces, the inner surfaces and the chewing surfaces of the teeth. You can see here, this is the next step that you have to follow to brush your teeth. Next one, use the tip of the brush to clean the inside surfaces of the front teeth using a gentle up and down stroke. Of the same way that you brush your teeth here, you have to do it but inside your teeth. Look, behind at the back of your teeth. And the last one, brush your tongue to remove bacteria and freshen breath. Now I'm going to show you the effects of poor dental hygiene on your body. So first of all, we have halitosis. Lack of regular brushing and flossing leaves small food particles with it between the teeth that collect bacteria and emit chemicals like hydrogen sulfide, the same compound that gives rotten eggs their characteristic smell. Then we have periodontal disease. Bone deterioration around the teeth leads to loosening and eventual tooth loss. 25% of us adults over 65 have lost all of their teeth. Also, we have hair disease. People with periodontal disease are likely to develop hair disease and arterial narrowing as a result of periodontal bacteria and plaque entering the bloodstream through the gums. In fact, one study found that the presence of gum disease cavities and missing teeth are as good at predicting hair disease as cholesterol levels. Also, we have arteriosclerosis. High levels of disease-causing bacteria in the mouth can lead to clogging at the carotid artery and increased risk of stroke. Also, we have diabetes. 95% of us adults with diabetes also have periodontal disease, and 1/3 have advanced periodontal disease that has led to tooth loss. Also, we have respiratory problems. Bacteria from periodontal disease can travel through the bloodstream to the lungs where it can aggravate respiratory system, especially in patients who already have respiratory problems. And finally, we have erectile dysfunction. Periodontal bacteria can travel through the bloodstream, inflaming blood vessels and blocking blood flow to the genitals. In fact, men with periodontal disease are 7 more likely to experience erectile dysfunction than men with good dental hygiene. So, as you can see here, we have the illustration of the effects of a poor dental hygiene on your body. Look, we have the halitosis here. Halitosis, we have here. You can see periodontal disease. We have here arteriosclerosis. We have here hair disease. Look, the heart disease. Also, we have here the diabetes, and we have here respiratory problems. Look. And finally, we have the erectile dysfunction. This happens in men only. So let's continue. Hygiene and skincare. The skin regulates the heat of the organisms. In it resides a sense of touch, of pain, and pressure. Eliminates certain residues through the sweat glands to prevent the bath from happening. Body debris from sweat it's necessary to bath and change underwear every day. Some baths are not recommended for the skin if they are not taken with the proper precaution, since they dry out and cause its premature aging. We must therefore protect ourselves with the base 50 sunscreen cream for face and body. So there are three different types of skin. Are the next: normal, you can wash it using soap and running water. Greasy, clean with soap and warm water preferably. Dry, use cleansing creams that are nutritious and moisturizing. Cleaning of the face should be done daily to avoid pimples and blackheads. So I'm going to show you now what do the people who cares their skin do. They never go to bed without washing their face. They stay hydrated from morning to night. They know which skincare ingredients to avoid. They are diligent with their skincare routines. They use an antioxidant serum. They change their pillowcase every 3 days. They avoid junk food. They use a face mask once a week. They exfoliate at least 1 or 2 days a week. And finally, they work out. So let's continue. Men who want to look good should shave frequently depending on hair growth. And if they wear mustache or beard, try to keep them clean. A daily bath is one of the hygienic habits that contributes the most to our health. In addition to cleaning the skin, produce well-being and confidence. The frequency of the bath should be determined by the work the person does. Some people need to bath twice a day. The hair, it is important to keep the hair neat and free of parasite. Pick it up if it is very long, so as not to contaminate food. The fully covered head is made up of a quantity of hair that oscillate in the 100,000 and 120,000, but all people lose between 50 and 100 per day. So, the hands and nails. Hands are important to keep completely clean. Dirty and careless hands, they are not in a position to handle food. Nails should be kept short and clean. Feet require frequent and careful cleaning, especially in hot weather because these parts of the body are rich in sweat and sebaceous glands that secrete substance that locked up by the footwear exhale bad odors. The nasal fauces, they are lined by a membrane formed by blood vessels called the pituitary that warm the air that enters the lungs and also has a large number of eyelashes that stop impurities from dust, smoke, and other agents that harm health. We need to keep them clean. We recommend the use of handkerchief. Care of the teeth consists of the elimination of food particles and cell deposits that accumulate on the teeth. Requires cleanings after every meal time and before bed. As I already told you, you have to clean your teeth to avoid different ailments. So let's continue with the next. We have eye care. The eye conjunctivitis transports its finger as well as handkerchiefs, covers, and other objects of personal use. So, for our hands in eye care, we have to cut our nails. Also, we have to wash our hands with soap and water. For our eye health, we have 8 tips here. So, first of all, we have regularly eyes checking. Also, we have proper lighting. Proper lighting. We have also blink frequently. Also, we have wear sunglasses on sunny days. We have distant adjustment. This is when you are using your smartphone or the computer. You have to have the distant adjustment. Also, we have gaze for a green tree. Also, we have eyes exercise. You have to do eyes exercise, moving your eyes. And finally, you have to eat healthy food. It could be like carrots. Carrots help you to improve your sight. We have here top ways to care for your feet at home. So use non-acetone remover, acetone polish remover, trim 2 nails, inspect 2 nails for issues and treat it if needed. Soak feet in warm water 15 to 20 minutes. Gently scrub 2 nails after soaking. Massage in lotion. Trim calluses and corns. These are some tips that you can use to take care of your feet at home. So now let's continue with the ears. It is necessary to keep them clean, also using a clean handlet or hyssop. The eyes haired in normal condition are able to clean itself, dream, and rest. It is necessary to sleep and the rest for the body to replace the fatigue. The person must sleep at least 8 hours a day, trying to get up a fixed hour. High of the clothing, the clothes are in contact with the skin. They are slaughtered with the sweat, the body fat, and dust. For such reason, it is necessary to change the underwear and stereo daily. Digestive system hygiene. We must do a diet balance with fruits, filling, and legumes. Do not eat or drink too much at every time of food. So now, before continuing, I'm going to show you some cares that you have to have with your ears. I'm going to show you facts and myths about ear care. So, 460 million people live with disabling hearing loss, who 1 billion young people from 12 to 35 years are at the risk of hearing loss due to recreational exposure to loud sound. So we have here the first myth. When you are exposed to loud noises, was builds up to protect your hearing. That is a myth. The fact listening to loud music can damage your ears in 30 minutes. So loud is 105 to 110 decibels. The level of a rock concert or the maximum volume of a typical portable music device, but you can damage your ears at 85 decibels, about the level of a hair dryer. If you are exposed over and over for a few hours at a time, so keep the volume down and try not to listen for too long. The next myth that we have here is using cotton swab is the best way to clean your ears. So that is a myth. The fact is, you should clean your ear with a washcloth. Never stick anything into your ear canal. Ever wash only the outer part of your ear with soap and water. And don't worry too much about earwax. It is a healthy part of your body's natural defense. No a sign that anything is wrong if you have pain or itchiness. Talk to your doctor. Next myth that we have here is ear candling is a good way to clean earwax. That is a myth. The fact is, candling is not a useful treatment and may even cause damage to your ears. The idea is to put the bottom of a hollow candle into your ear and light the other end. It is supposed to pull out the wax, but don't do it. It is not a useful treatment for, well, anything, and it can push earwax deeper in. Get candle wax inside your ear, put a hole in your eardrum, or burn your ear canal. Face or scalp, see your doctor if you think you have a problem with earwax. The next myth that we have here, tinnitus ringing in your ears is curable through eardrops. That is a myth. The fact tinnitus may never go away. It is caused by medication, too much earwax, or problems with your blood flow. Your doctor may be able to treat it, but it is also can be a sign of permanent damage to your ears from noise. Steady noise as from a race car, or sudden as from an explosion, as well as secondary to a head trauma. To prevent damage to your hearing, wear earplugs when you know you're going to be in a loud place. The last myth that we have, hearing loss is a normal part of the aging process. The fact is somewhat common among the elderly. That doesn't make it normal. You may be surprised that only about 35% of those affected by hearing loss are over 64. While it may be somewhat common among the elderly, that doesn't make it normal or inevitable. Steps can be taken to protect your hearing to avoid losing it even as you reach the age of retirement, rather than simple accept hearing loss as one of the downsides of aging. You can improve your hearing with the use of hearing aids. So, understanding proper ear care will go a long way in both protecting your hearing and your ear, and the effectiveness of your hearing aid. So let's continue with the hygiene of the respiratory system. Let's do play and exercise. Live in dry places and ventilate rooms. Adopt correct sitting, walking, sleeping, and standing positions. Do not wear teeth clothing and not smoking. So I'm going to show you some examples that you have to follow to keep your hygiene of the respiratory system. So as I already mentioned, to staying healthy, you have to avoid smoking. Why? Because it is very dangerous for the respiratory system. You have to reduce fatty food intake and keep a balanced diet. Maintain high standards of hygiene. Follow an exercise routine. And you have to protect yourself against pollution. And finally, you have to stay hydrated. So let's continue now with the hygiene of the nervous system. It is necessary. Sleep prudent time to recover energy. Distract healthily. Do not get carried away by emotion, for example, anger, envy, rancor, gluttony, etc. Enjoy the good things in life. Also, we have the physical hygiene. Exercise helps. facilitates circulation, it helps digestion, stimulates muscle and growth. Hygiene of the place where food is prepared includes cleaning the place where food is to be prepared. So, the equipment and utensil hygiene. The utensil and equipment used must be washed before and after use. We have also food hygiene. The hygiene principles indicated above are the basis for proper food preparation because food contains the nutritional substance that the body needs to perform all biological functions. It is necessary that we maintain adequate hygiene from its selection, purchase, and preparation. Also, we have here the nutrition. Nutrition is the biological process in which organisms assimilate food and liquids necessary for the operation, growth, and maintenance of their vital functions. So, nutrition is also the science that studies the relationship between food and health, especially in the determining a diet. Although food and nutrition are frequently used as synonyms, they are different terms since nutrition refers to the nutrients that make up the food and components a set of involuntary phenomena that occur after ingestion of food, that is, digestion, absorption, or passage to the blood from the digestive tract of its nutrient components and its assimilation into the body cells. So, the nutrition is the science that examines the relationship between diet and health. Nutritionists, nutritionists are health professionals who specialize in this area of study and they are trained to provide dietary advice. Also, we have food comprises a set of voluntary and conscious acts that are aimed at the choice, preparation, and ingestion of food phenomena, closely related to the sociocultural and economic environment and determine, at least to a large extent, dietary habits and style of lifestyle. We have here proper nutrients is what covers the energy requirements through the metabolization of nutrients such as carbohydrates, proteins, and fats. These energy requirements are related to the basal metabolic cost, the cost for physical activity, and the cost induced by diet. The needs of non-energy micronutrients such as vitamins and minerals. The current hydration based on the consumption of beverage, especially water. The sufficient ingestion of dietary fiber. Dietary goals are represented by different graphic resources. One of them is a food pyramid. I'm going to show you now some examples of the nutrition, and also I'm going to show you the food pyramid that we have to follow to have a good nutrition. So we have the nutrition process. The nutrition is the process of taking in nutrients from the food you eat. The human body needs these nutrients to live. How the human body does take these nutrients from food? It has four different systems: the digestive system, the respiratory system, the circulatory system, and the excretory system. So, the digestive system. The digestive system changes food into the nutrients our body needs to get energy. We have the parts of the digestive system. The digestive process starts in the mouth, where our teeth cut and chew the food. Our tongue mixes the food with saliva and pushes the food into a tube called esophagus. So you can see here, we start the process here with the mouth. So after it said the food comes into a tube called esophagus. This one is the esophagus. Look, this one is the esophagus. So the food travels down the esophagus to our stomach. The stomach mixes the food with gastric juice to turn food into a thick liquid. As you can see here, the food comes from the mouth through the esophagus and it's arrived in our stomach. And in the stomach mixes the food with gastric juice and to turn food into a thick liquid. So let's continue with the liver. So the liver and the pancreas send juices to a long tube called small intestine, where the liquid passes into the blood. So as you can see here, we have here the large intestine. Look, this one is the large intestine. So the parts of the food that our body can use, that means the nutrients, go into a wide tube called large intestine. Look, this one is the large intestine and this one is the small intestine. This one that is in color pink, that is the small, and the large is in color red. So finally, the remains or wastes, what is not nurtured for our body, leave our body through the anus. Look, everything that we don't need, we throw it by the anus. So now I'm going to show you the food pyramid. This one is the food pyramid. Look, as you can see here, we have at the top of the pyramid, we have 5%. What is that 5% that we have to eat? Is fat, oil, sugar, and sweet. That is at least that we have to eat. We don't have to eat too much candy. We don't have to eat too much oil or grass food. The next one that we have here is that 20%. In 20%, what do we have to eat? We have to eat meat, fish, milk, and eggs. As you can see here, we have the meat, the fish, the milk, and eggs. We have to eat the 35% of fruit and vegetable. As you can see here, we have to eat a lot of food and a lot of fruit and a lot of vegetable. And finally, we have the 40% that we have to eat bread and pasta. The 40% that we have to eat in our meals is bread and pasta. As you can see here, we have some bread here, we have some cereal, and also we have some pasta. And that is all for this class. And we are going to have a review of the care of our body. So I'm going to show you some pictures and I'm going to show you some tips that you have to take in account to take care about your body. So watching the body helps keep it free of disease-causing germs. Also, cleaning teeth helps keep gums and teeth healthy. Washing hands after going to the toilet helps stop the spread of germs. Washing hands before preparing food helps keep germs out of our bodies. Washing hands before eating food helps stop germs getting into our bodies. Washing clothes helps keep them free of disease-causing germs. Hanging clothes in the sun helps to kill some disease-causing germs and parasites. Covering the nose and mouth when sneezing helps stop the spread germs. So that is all for this class. I hope that you understand the topic and I wait that you send the homework. Remember that you have to send a list of some tips that you have to take in account to take care of your body. So see you in the next class and see you later. Thank you for your attention and have a good day and take care. Goodbye.